أشرف المرسلين وعلى آله وصحبه أجمعين. Our lesson today is Toxoplasmosis by Professor Mahmoud Hani Sulaiman. Before we begin, we will talk about transplacental, intrapartum, and postnatal infections. What is meant by transplacental? Transplacental during gestation, either the pathogen penetrates the placental vascular barrier or rarely bleeding of maternal blood into fetal circulation carries pathogens. During the birth, it is one of three methods: exposure to maternal blood during placental separation or delivery trauma. Second, organism may colonize the amnion or amniotic fluid, especially in a long interval between membrane rupture and delivery. 3. Pathogens may be present in the birth canal at the time of delivery. 1, 2, 3. In the neonatal period, from close oral contact, from breastfeeding, by fecal-oral spread, especially in conditions of poor hygiene. Transplacental infectious diseases are 10. Rubella virus, cytomegalovirus, human parvovirus B19, herpes simplex virus, HIV, human immunodeficiency virus, varicella zoster, vaccinia virus, trypanosoma pallidum, Toxoplasma gondii, listeria, monocytogenes. 10 diseases. Intrapartum are 9 diseases: cytomegalovirus, herpes simplex virus, hepatitis B virus, HIV, human immunodeficiency virus, Escherichia coli, group B streptococcus, chlamydia trachomatis, Neisseria gonorrhea, listeria monocytogenes. 9 diseases. Postpartum are 7 diseases: cytomegalovirus, hepatitis B virus, varicella zoster virus, human T lymphotropic virus 1, human immunodeficiency virus, HIV, herpes simplex virus, enteroviruses, e.g. echovirus type 11. 7 postpartum pathogens. Causative agent of toxoplasmosis is Toxoplasma gondii, intracellular coccidian of cats family Sarcocystidae. Toxoplasma gondii, which is intracellular coccidian of cats. The Toxoplasma is of family Sarcocystidae. Life cycle 3 stages. Tachyzoid during acute stage invades and replicates in cells. Bradyzoid in latent infection present in tissue cyst. Sporozoid found in oocysts which are resistant. Members of family Felidae, domestic and feral cats, are definitive hosts of Toxoplasma. We are still in causative agent. In acute infection, cat excrete in feces unsporulated, which equal uninfectious oocyst. After days or weeks, oocysts sporulate and become infectious. In favorable, warm, moist soil, oocysts remain infectious for 1 year and not survive in arid, cool climate destroyed by heat. This is the life cycle of this organism. Pathways for infection with Toxoplasma gondii. Only source for production of gondii oocyst is feline intestinal tract. Feline intestinal tract. Humans usually get disease by direct ingestion of oocyst from contaminated source, e.g., soil, cat litter, garden vegetables, or ingestion of tissue cysts present in undercooked tissue from infected animals. Ingestion of tissue cysts present in undercooked tissue from infected animals. Fetal infection occurs most commonly following acute maternal infection in pregnancy. But it also can occur following reactivation of latent infection in immunocompromised women. This is another life cycle, shows that life cycle of with dashed arrow indicate transmission by tachyzoid, which is mild. Dark blue arrow indicate transmission by cyst bradyzoid, which is severe, which occur with organ transplantation. Light blue arrows indicate transmission by oocysts. This is the light blue, this is the dark blue, this is the dashed arrow, which is mild, which is severe. Occurrence worldwide in mammals and birds. Infection in man is common. This is the global status of Toxoplasma gondii and implications for pregnancy and congenital toxoplasmosis. You see, in Egypt, it is more than 60%. Reservoir of infection. Definitive host is cats and other felines. Cats. Cat infected by eating infected rodent or bird. Here we remember that in rabies we said that cat can transmit rabies, and now it transmit toxoplasma. Cat infected by eating infected rodent or bird. Felines harbor parasite in GIT, where sexual life cycle happen and excrete oocyst for 10 to 20 days. Intermediate host, sheep, goats, rodents, swine, cattle, chickens, birds, all may carry infective stage, cystozoid and bradyzoid, encysted in tissue, especially muscle and brain. Tissue cyst remains viable for life of animal. Transplacental only if a pregnant woman gets primary infection with rapidly dividing tachyzoid circulating in bloodstream, ingesting oocyst in polluted sandbox in child. Child can get infected by eating polluted sandbox, eating undercooked pork, meat, drinking polluted water or milk, rarely blood transfusion or organ transplant from infected donor. Again, this is a scheme for life cycle of Toxoplasma. Toxoplasma gondii only source to produce Toxoplasma oocyst is feline intestinal tract. Humans acquire disease, as we said, by direct ingestion of oocyst from contaminated source, soil, cat litter, garden vegetables, or ingestion of tissue cyst in undercooked infected animal. Fetal infection after acute maternal infection in pregnancy and after reactivation of latent infection in decreased immunity women. Toxoplasmosis. Here the woman is cleaning the litter of the cat. The mother may be infected by improper handling of cat litter, handling or ingesting undercooked infected meat. Fetus may contract infection through placental connection with primary infected mother. Incubation period about 3 weeks. Period of communicability. Oocyst shed by cats sporulate and become infective in 5 days later. Cysts in flesh of infected animal remain infective as long as meat is edible and uncooked. Susceptibility and resistance. General immunity is readily acquired, long-lasting. Most infections are asymptomatic. Patients undergoing cytotoxic or immunosuppressive therapy are highly susceptible. A usual complication of AIDS is reactivation of infection. Again, haematogenous spread of Toxoplasma in infected human. Tachyzoid pass the circulation, means parenteral, in the blood vessel. Circulating tachyzoid reach various tissues. Here is the various tissues it may reach, especially brain, eye, skeletal muscles, heart, and form tissue cyst. Persist for human's life. Clinically, a systemic protozoan disease, frequently asymptomatic or shows fever, lymphadenopathy, lymphocytosis for days or weeks. In immunodeficient patient, primary infection may show pneumonia, cerebral signs, rash, etc., even death. Dormant infection can reactivate in AIDS patient. During pregnancy, primary infection in early pregnancy can lead to congenital toxoplasmosis with chorioretinitis, brain damage, cerebral calcification, fever, rash, hydrocephaly, microcephaly, jaundice, convulsions, hepatosplenomegaly, or death. Later in pregnancy, maternal infection may lead to subclinical disease with recurrent chorioretinitis. Here is a picture of a 12-day-old boy with congenital toxoplasmosis with marked hepatosplenomegaly. This picture shows a 3-day-old boy presented with azizir. CT scan showed hydrocephalus, periventricular calcification. Here is the calcification, suggestive of congenital infection as toxoplasmosis, rubella, cytomegalovirus, or herpes simplex. So this picture can be seen in these diseases: toxoplasmosis, rubella, cytomegalovirus, or herpes simplex. Toxoplasma serology was positive in this patient, and neonate treated for congenital toxoplasmosis with pyrimethamine, sulfadiazine, and folinic acid. Pyrimethamine, sulfadiazine, and folinic acid. This picture shows a neonate with congenital toxoplasmosis with chorioretinitis. CNS affection in Toxoplasma may lead to hydrocephalus, microcephaly, or convulsions. Diagnosis: Clinical, as we said, various clinical manifestations, imaging, X-ray calcification as shown by this arrow, ultrasound dilatation of ventricles in brain, as we said before. Lab diagnosis of toxoplasmosis, serology. Detection of IgM in patient's blood indicates active infection. IgM equal active infection. IgG rising titer indicates active infection. IgM equal active infection. IgG rising equal active infection. Sabine-Feldman dye test. Sabine and Feldman put Toxoplasma trophozoite on a slide, as we see, then add patient serum and trophozoite, then stain. If trophozoite gets stained, serum negative for Toxoplasma. So negative equals stained equals negative Toxoplasma. If trophozoite do not stain, serum is positive for Toxoplasma. Frankel test, which is called Toxoplasmin ID test. Molecular techniques, detection of parasite DNA in patient serum. Lab diagnosis of congenital toxoplasmosis. IgM in baby's blood equal fetal infection. Maternal IgM does not cross placenta. Parasite DNA in infant's urine or amniotic fluid by PCR. This is the third method. Treatment, as we said, pyrimethamine and trisulfapyrimidine. Pyramycin to infected pregnant women. Here this table is important. It shows interpretation of Toxoplasma antibody test. It shows 9 cases of IgG result and IgM result. This is negative, this is negative, this is negative, this is equivocal, this is negative, this is positive, and so on. 9 cases. Please print this and use it in the clinic to decide what to do to the mother and to the fetus. It will help you very much. Preventive measures. Cook meat well till color change. Cat, what we will do with cat? It is long, as we will see. So anyone keeps an animal, cat, dog, and so on, must take care of this animal to not to be diseased and not to transmit disease to himself or to others. For cat, what he do? The cat feed on dry canned food. Feed them on dry canned food. Keep indoor to discourage hunting. Dispose daily their feces before sporocyst sporulation, which is the infective stage. Feces flushed down toilet, burned or deeply buried. Disinfect litter pans daily by scalding. Wear gloves when dealing with potential infective material. Do not shake dried litter to avoid dispersal of oocysts in air. Control stray cat and prevent their access to sand used for play by children. Still in prevention, pregnant women examine for Toxoplasma antibody. If negative, equals susceptible. If negative, equals susceptible. Should avoid, the negative one should avoid cleaning litter pans or contact with cats of unknown feeding history. Wear gloves during gardening. Wash hands thoroughly after work and before eating. Educate pregnant women about these measures. Educate pregnant women about these measures. Wash hands thoroughly after handling raw meat or soil, possibly contaminated with cat feces, and before eating. AIDS patient given pyrimethamine in this dose plus sulfadoxine in this dose or Fansidar in this dose for life. For life. AIDS patient will have this for life. Still in prevention, peeling or thoroughly washing fruits and vegetables before eating, cleaning cooking surfaces and utensils after they contacted either raw meat. Any contact with this, you must clean cooking surfaces and utensils. Raw meat, poultry, seafood, or unwashed fruits or vegetables. 5 items of food we should clean cooking surfaces and utensils because of them. These are measures to prevent primary Toxoplasma gondii infection. Please print this and use it in your clinic for health education of a pregnant woman. Use for health education of pregnant woman. Please, if you are working in an Arabic country or any other, translate this to the language you are using at your clinic and use it for health education. Chemoprophylaxis for Toxoplasma. Immunocompromised patients give sulfa 1 double strength or single strength tablet daily or dapsone in this dose plus pyrimethamine in this dose plus leucovorin in this dose. If patient has HIV, start if CD4 count. This is details of what we said before. Start if CD4 count is less than 200 cells per millimeter cubic per cubic millimeter. Stop if patient is on ART and CD4 more than 200 cells for at least 3 months primary prophylaxis or 6 months chronic maintenance. The chemoprophylaxis for those recipients of organs, Toxoplasma seropositive HSCT recipients, this is what to do with him. This is for immunocompromised patient, and this is for those receiving organ transplant. Please print and use. Control of patient. Notify desirable to understand epidemiology. Isolation, concurrent disinfection, immunization, none. Isolation, concurrent disinfection, immunization, none. Treatment. In primary infection during pregnancy, spiramycin and pyrimethamine and sulfadiazine when fetal infection is documented. In chorioretinitis or organ-involved, pyrimethamine, sulfadiazine, folinic acid to avoid bone marrow depression, folinic acid to avoid bone marrow depression. Congenital infected asymptomatic child treatment 1 year to prevent chorioretinitis. Control of contacts, investigation of contacts and source of infection. In congenital case, determine antibodies in mother and members of household. In acquired case, determine exposure to infected animal, cat, feces, soil, or raw meat. And at last, this is a summary for this lesson. I put it here to help you to summarize the details I told you. just read it and use it. and وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thanks for your